Welcome to my YouTube channel. Today I will be talking on again very important topic on antibiotic resistance spread, which has become a global concern today. Even our Prime Minister, Honorable Prime Minister, has mentioned in his Man Ki Baat that antibiotic resistance is very important, and to stop this resistance is again very important and responsibility for every citizen of country. How we can control it, today we'll discuss some aspects. In my last video we talked about some basic rules, basic steps that can be implemented in your life, if possibly that you can control the antibiotic resistance. uh, in this video we'll be more focusing on global spread and global emergence, and we should also aware about how the resistance is spread, because there are many uh, peoples are having in confusion that uh, this I'm talking in reference to my earlier video where we talked that over the counter sale of antibiotics should be stopped so we can control the antibiotic resistance. But the question is that even in many countries like in US and UK and other European countries, the sale over the counter is definitely banned, and without prescription from physician, nobody can take any dose of antibiotic, from even a single dose of antibiotic, from any pharmacy. But in spite of that, the resistance is being spread. So what is the reason? So this is not the only reason to spread the antibiotic resistance, that to control the sale over the counter. But this is important for Indian scenario, because in India every second person is approaching to pharmacist and asking the drug and asking the medicine for their some disease, infection, or some small kind of a sore throat, or cough, or anything like related to viral infection, and he's consuming a lot of drugs. In foreign countries, especially the developed countries in United States and Europe and UK, the resistance is being spread in spite of having ban on the over-the-counter sale. But there's many more reasons for that. As we discussed in my some other videos, that what is the transmission dynamic and how the transmission of these ARGs. ARGs means like a drug-resistant gene from one bacteria to another bacteria is spreading in the environmental setting, and having that in consideration, One Health approach is one of the most important, the aspects today that to look into and to understand that how the transmission of these resistant gene is from animal to human, and from water bodies, sewage waters, domestic sewage waters, and hospital sewage water. Well, so again I come to the point that how this resistance is being spread there. So there's one thing which is very popular is medical tourism. If you remember in 2008 and 9, there was a discovery of the detection of rather NDM1, New Delhi metallobutyrectomase. There was a havoc, like NDM1 was spread and all over the world, and it started from India. So the name was given New Delhi metallobutyrectomase. But the story was this, that the Swedish person living in Sweden, he traveled for some surgery or some treatment, in India, and he stayed there for some time, and he acquired some infection. Later on, he found that to have such kind of a resistant gene that is called NDM1 in the bacteria, Klebsiella pneumoniae or E. coli. Now, this is how the NDM was spread, and then now we have more than 90 variants of NDM have been discovered to date, having several mutations. So the point here is that medical tourism is another thing. Then traveling is again, people start traveling from one city to another city, and one country to another country through, and they are carrying infection. And while carrying infection, they carry also the gene from one bacteria to another bacteria. So this is another reason. This is how the infections are being spread in these countries where the wash is being already implemented. For example, clean water, hygiene, and sanitation taking into consideration. But in spite of that, infection is being spread through traveling and through many ways. And that is one of the reasons that these resistant genes are being taken from one place to another place. Well, this is one part. Second thing is that how the infection, these genes are being spread from one bacteria to another bacteria across the species, across the genera even, uh, through horizontal gene transfer, right? So which cannot be stopped by any mean until you cut down the infection. So hospital infection management system should be strong. In hospital, hygiene and sanitation should be, should be strengthened in order to clean these things and clean every things which is in contact with the patient, with the wards, those who are working in the wards, and nurses and healthcare workers, so that infection may not be transmitted from one person to another person, or from patient to patient, or from hospital workers or healthcare workers to patients. So wash your hands, sanitize your hand before you handle patient. Wash your hand before you, handle with patients in at your house or in the hospital, admitted patients. So this way, if you cut down the transmission line or the chain of the transmission of the infection, then probably the resistance can also be controlled, and you can also save the antibiotics in that case for your future. So I think this is important information which I want to share to you, and I think you can also share among your friends if it reached to you. And this is through my YouTube channel. Thank you very much.